Hello, everyone. Thank you for the opportunity to be here with you today. My name is Travis Williams, and I'm excited to be joined by our partners at the Mount Sinai Health System to discuss leading with equity, breaking down the barriers to communication and telemedicine. For today's topics, I'd like to start by discussing language barriers in telehealth. I'll then transition it over to Erica, who will provide a brief overview of the Mount Sinai Health System. Sylvina will discuss the organization's journey to make telehealth accessible to all of their patients and share some interesting findings from a survey with their limited English proficient patients. The Mount Sinai team will then wrap up by discussing their ongoing work towards the goal of full accessibility. Telehealth appointments are more prevalent than ever. The promise of telehealth is that it is more inclusive, helping underserved audience access much needed health resources. Yet, most telehealth platforms haven't accommodated the need for language access, leaving a massive audience on the outside of medical care looking at it. 1 in 5 households already speaks a language other than English. Soon, America will have more Spanish speakers than any other country, and 90% of our population growth is expected to come through immigration over the next 4 decades. We are becoming more diverse very quickly. At LanguageLine, we have the unique perspective of working with some of the largest telehealth providers in North America, and their view is that language access is an essential component to the advancement of telehealth. The challenge is that the telehealth market is moving so fast that many platforms had initially overlooked the healthcare community's need to provide language access to limited English speakers, the deaf, and the hard of hearing. A study released in March on disparities in telehealth use among California patients with limited English proficiency found English speakers use telehealth more than 2.5 times that of their limited English proficient counterparts. We've been listening to our healthcare clients about their challenges overcoming these barriers, and it was through these discussions that LanguageLine for Telehealth was developed. At LanguageLine, we've partnered with healthcare providers across North America to give them the ability to invite professional, medically trained interpreters to their telemedicine sessions. Our on-demand interpreters are available to assist in both video and audio-only formats. Now, I'd like to turn it over to Eric and Sylvina to share how their organization is working to overcome barriers to care and improve the patient's experience along the way.
Thanks so much, Travis. It's great to be here with you all today. I'm going to give an intro into the Mount Sinai Health System, and then I'm going to turn it over to Sylvina. So here at Mount Sinai, we have about 8 hospitals located throughout New York City and Long Island. We see well over 4 million patients a year. We have over 410 ambulatory practices. Our workforce consists of about 42,000 employees, and we have a very close affiliation with the Icahn School of Medicine at Mount Sinai. So I think it's important to mention our health system values. I would say that in the last year, the values of safety and equity have never been more important to us here at Mount Sinai, doing so much work with our patients as well as our workforce around keeping everyone safe and really always looking through, especially the patient experience, through the lens of equity. And that's really set us up for how we see our patient experience moving into this year and beyond. And it also helps the framework around what really drove us to want to partner with folks such as LanguageLine to do the work that we're doing. So if we go to the next slide, this is really just showing how we're defining the patient experience. We really see the experience as something that is safe, compassionate, and equitable for our patients and their families always. We've really strived to put equity at the forefront and really have it be a strategic priority at the Mount Sinai Health System. This slide gives you a look at our top 10 languages. We have many, many languages, as you can imagine, given our location of the New York City metropolitan area. But as Travis mentioned, Spanish is certainly our largest language of our patients who have limited English proficiency, followed closely by the Chinese languages. And then you can see the rest here in our list. And I will also mention we're very proud that our deaf and hard of hearing population who communicate with American Sign Language is growing at the Mount Sinai Health System. And we strive to be excellent healthcare providers for that population as well. So if we move to the next slide, I think it's really fascinating, and I think a lot of health systems across the country can show something similar to this, that as we were going through the pandemic, we really grew exponentially in the way that we offered our telehealth or telemedicine visits, as you can see here, right? Pre-pandemic, we had roughly 50 to 60 providers that were offering telehealth. And as of February, we had well over 2,000 faculty and non-physician providers that were supporting our patients virtually so they could stay safe at home while also receiving excellent health care. We certainly leveraged our existing infrastructure in order to rapidly onboard and train providers. And this really sets us up for thinking about, well, how are we going to offer this platform and this type of modality of care to all of our patients, right? Not just the patients that it might be easiest to, but our patients that have language needs and other types of needs. And so we're so grateful for our partnership with LanguageLine, but I am going to turn it over to Silvina so she can talk more in detail about how this was operationalized.
Thank you so much, Erica. The ramp up in telemedicine has been, and it continues to be, a very challenging journey for our patients, for our health system, but in particular for patients with limited English proficiency and patients with disability. After all, telemedicine was not really designed for patients with disabilities or other communication needs in mind. It was working well with one-on-one communication, one-on-one encounters between patient and provider. But what COVID-19 really brought to light are all the disparities and all the vulnerabilities that our patients have to face to receive equal access in healthcare. When we started using telemedicine, only a few physicians were using it. But then when there was a bigger need, there was a lot of confusion, right? There were a lot of telehealth platforms being used. Providers were new to it. Not everybody knew how to use it. And on our end, we didn't really know how to provide interpretation services for patients who needed it. I remember the beginning of telehealth. Providers used to hold a cell phone to call LanguageLine, connect with an interpreter, put the interpreter on speakerphone, and hoping that the computer will pick up the sound. It was really a frustrating experience for these providers, for the patients. There was a lot of feedback on the line. There was some echo and residual noise. So we really have to come up with different solutions. And it was one day when we were together with Travis that we actually decided to connect. And this is the key word. We decided to connect the IT teams from LanguageLine, from Mount Sinai, from Epic, and from a separate platform called Care Agility to work together and bring solutions to our virtual encounters needs. So this is the platform that we have today. And even though, as I mentioned earlier, we use many platforms, we're going to focus today on sharing the results of our main platform for ambulatory telehealth, which is called Epic. In this platform, we were able to integrate audio interpretation services, and it's very simple to use. It requires that the provider sends a link. It's very easy to use on the patient side because there is no need to download any app. There is no need to create any registration or username. Patients can simply click on the link and connect. And once connected, the provider can also invite participants. It could be a staff interpreter, or it could be also an on-demand interpreter from LanguageLine by clicking a button. So there was an urgent need, of course, to educate providers and to educate patients. Our Epic team really quickly put together a step-by-step guide for providers, as providers were using different devices. They were generating encounters from PCs, but also from iPads and cell phones. So they quickly put together a guide with lots of visual components, and they broadcasted this guide to our organization. Then on our end, language services reshare the document over and over again, because as we know, not everybody may read the broadcast. So that's how we really voice it out and make it accessible to providers and patients. And just like with any initiative that we start at Mount Sinai Health System, we cannot claim that it is a success until we hear the voices of our patients. And this is so important to us because they are really the drivers here. They are the ones who tell us what they need, when they need it, how they need it, and they are really the drivers of change to our organization. So our team decided to take a sample of telemedicine encounters of LEP patients for our top languages, and we decided to conduct a brief survey over the phone to basically obtain feedback and see how we were doing with the services that we had established, right? We needed to measure the quality of the audio interpretation service that we had in place. We also needed to assess how urgent it was to integrate video interpretation services for spoken languages and ASL. And we needed to identify gaps that were beyond language access, where the patients the patients had limited digital literacy. How about equipment? Did they have equipment available to have the encounter? What about connectivity? Was there a connectivity problem? And if so, was the connectivity problem on our end, on their end? We also wanted to see what was their preference. Was telehealth here to stay? Were they going to prefer this modality, or this is something that we were doing just in the meantime to keep themselves safe? And then in the end, we also wanted to chat with patients. It's good to call them sometimes, and I said this, when you're working in your office and you're dealing with lots of projects and data and things, simply to reach out and talk to a patient, it brings some happiness to your day. So I'd say I did this with a lot of pleasure. I was calling about, I would say, 35 patients on my own, and I really had a lot of good connection with these patients, and they were really, really appreciative of our call. We conducted this survey in January and February of this year. So as you can imagine, it was very cold in New York. And to my surprise, all patients pick up the phone. So it's very important for us to know if the interpreter was really facilitating communication, if that communication was effective. So we asked patients, were you able to understand the interpreter? Was the interpreter able to understand you? Did you have to repeat yourself many times? How about the audio quality? Were you able to hear the interpreter well? So most of them, 96% actually of them said yes. Only 4% said no, but it wasn't really a lot of negative responses. Just like, sometimes you get good feedback and sometimes negative feedback, but we welcome all. And I have to say, I was very surprised to speak with different patients, in particular with geriatric patients whom I didn't think that they were going to answer the telephone. But as I mentioned, it was wintertime, so everybody did. And I remember speaking to this 90-year-old man who was at home, and he told me that he was very grateful and very satisfied with the services received, and that he felt very safe with the video visit. I also have to say that in part of the callers were mainly oncology patients, pediatric patients. I was speaking to their moms, and also patients from primary care, genetics, and allergy. Those are the ones that I remembered most. So we knew that we had set up audio interpretation services and wanted to measure how important it was for our patients to see video. And to my surprise, you would have think that patients really wanted to have interpreters on video. But to my surprise, to our surprise, 86% of them said that no, that this was not really necessary, that they were very happy as long as they could see their provider on the screen, that it felt almost as the same as when they go to visit their doctors in person, because of course, a lot of our practices, not all of them, but a lot of them use the over-the-phone interpretation services. And we have other practices that, of course, have video and in person as well. But they were really very satisfied with this. And as an interpreter, I also have to say that the audio interpretation services really support the invisibility of the interpreter. As interpreters, we are just supposed to be the voice of the patient and the voice of the provider. So this is really, we found that this was really a successful modality to implement for telehealth. And when we checked in with providers to see if it was important for them to see the interpreter on the screen, most of them said actually that no, that seeing an interpreter on the screen was sometimes a bit distracting. And as long as they could see the patient and provide care to that patient and hear the interpreter, they were satisfied with that. Of course, this is different for patients who are deaf and communicate by using American Sign Language. But the focus here of this presentation is really on spoken languages. We also wanted to find out what made a good encounter. And we asked patients, was the interpreter present from the beginning or from the start of the video visit? And this is what really, when we really saw an opportunity for change, an opportunity for improvement. With only 52% of the providers were really connecting with an interpreter prior to initiating the encounter. 48% of them didn't. And when we talked to those 48%, they really told us, the doctor didn't know that I need an interpreter, but I know that that they record my language. And so we really took that as an opportunity for best practices, really. Those providers who connect with an interpreter and welcome the patient with an interpreter already joined have much more success, or let's say the patient is perceives that is welcomed in a much better way in its own language. And as I mentioned, we were trying to identify opportunities. We were asking patients, is there anything that we can do to improve the experience? And we obtained different answers. Some of them said, well, the doctor was typing all the time and I could hear the typing, and this interfered with the voice of the interpreter. So I have to tell the doctor to stop. So these are patients telling us that they also want their providers to be fully present for them. We took that as a positive feedback as well. We also heard, we had some comments that had to do with connectivity, with disconnection, but we didn't really know, we couldn't really pinpoint if it was a disconnection from Mount Sinai or was really on the patient side. So that, we were not really able to determine. Lastly, we were asking patients if they would recommend telehealth visits to other friends or families who also needed interpretation services. 88% of them said yes, and 12% said no, there's nothing like going in person, seeing my doctor, having my blood pressure checked. But a lot of them also mentioned that it was very convenient, that they could see the interpreter and the doctor and save time, and or that they could eliminate at least one doctor's visit, and that at least during these times it was a way to keep everybody safe. That was part of their feedback. Moving forward towards full accessibility. So as we are implementing solutions, we are finding new needs that need different solutions, right? We were able to we're able to provide services to our deaf and hard of hearing patients if we engage our staff interpreters. So that is, we do it. So for those of you who may be wondering, what about patients who are deaf? We have sign language interpreters on staff, and we are able to schedule interpreters ahead of time and be available for these encounters. But we still haven't come up with a solution with our vendor, and we are working towards that. We're also finding out that patients who are LEP and hard of hearing, for example, a patient who speaks Arabic and hard of hearing, patients really like to have captions in that preferred language. So that's a new need. We know that some telehealth platforms have captions in English only, but I'm wondering if sometime in the future, we're going to be able to see both languages displayed on the screen. Scheduling interpreters ahead of time for rare languages on telehealth platforms. So we know that we can easily find interpreters for the most common languages, but sometimes we have languages like Uzbek or Soninke, Mandinka, and we really need to look for an interpreter ahead of time. So this is something that we're also working with LanguageLine. It's another improvement. And ultimately, our goal is to make all the telehealth platforms as accessible as possible to all our patients.
Erica and Silvina, so a question that I have for you both, what has surprised you the most about implementing telehealth and language access at the Mount Sinai Health System?
What surprised me the most is really how easily we were able to connect and work together once our teams were able to communicate and find a solution for the need. I feel that initially there was a lot of confusion. We didn't know exactly in which direction to go. But once we connected all the teams and we knew that we have an imminent need to find the solutions because our patients were suffering, we quickly found the solution. I think it took us about a month and a half for this to go live. So it wasn't really that difficult. And we have all the experts working on this. So that was something that really surprised me.
Yeah, Silvina, I would agree with what you're saying. I mean, for me, what comes up is we really were pretty much in the beginning when telehealth really started the need really grew. We became almost paralyzed by the fact that there were so many platforms that just our health system alone was using. There were so many different ways that showed up as barriers to getting that interpreter in the way and the time that we needed it, making it easy not only for the patient, but also for the provider. And when we kind of cleared the way and we said, let's try with this one platform, let's partner with LanguageLine, our trusted partners in doing this work together for several years now. We were able to really come up with a solution, like you said, in not that much time. And I think we all really had that same mindset of we have to do what we can to get sort of the right accessibility to our LEP patients.
Thank you both for that. I appreciate it so much. Thank you, Silvina and Erica, for sharing the Mount Sinai Health System's experience and your continued efforts to lead with equity. Thank you, everyone, for joining us today. We look forward to your questions.